Off the beaten path in small towns across Kentucky, healthcare means hope. Local health centers are charged with the task of being so much more than convenient clinics. They're pillars of wellness for the people they serve. They uplift communities, helping people take charge of their well-being and build a future filled with pride, purpose, and possibility.
Mountain Comprehensive Health Corporation is a federally qualified health center. We're located in the coal fields of southeastern Kentucky. MCHC is in 8 counties, including 1 in Virginia, and we have 14 clinics throughout the area. Whitesburg is where our administrative office is located. It's a small town of about 2,000 people, and it's kind of the center of what we do. We're very proud of this community, as we are all the communities that we serve. When we go into an area, we want to be a community builder. We don't want to be a taker.
Mountain Comprehensive's presence in the community is more than just medical. It's deeply personal for those who work here. Through a unique incentivizing program, they've created a space where healthcare becomes a partnership, which has led to incredible health outcomes.
Our staff is what is the heart of this company. We can't provide medical services without doctors and other types of providers, but without the staff, nobody's going anywhere. We're always trying to think of ways to make things better for the staff. The ideal is to help encourage people to do their annual prevention. If you, as an MCHC employee, no matter where you're at, you're eligible for it. All you have to do is make sure by the end of the year that you have verified in your employee record that you've had your wellness exam and either a optometry or dental screening in the last 12 months. And if you do that, then we give $1 an hour raise for all the next year. Salary people get $2,080, and hourly rate gets $1 for each hour they worked.
I started working here in March of last year, and they always ask the employees to participate in the wellness program every year that they have. And I've never had a mammogram before, never done a wellness exam before. So my experience was that I had a bad mammogram come back, and it was DCIS breast cancer. If it wasn't for the wellness exam, I would have never found out that I had it. It could have been too late, but they caught it in an early stage.
The beauty of community health centers is that they're integral parts of the community. They are taking care of their patients, but they're also employers. And so when an individual seeks care at their community health center, they most likely know their provider. And so an employee wellness program, what it does is it gives integrity to the program, because that provider is saying, I recommend you do this, and they've done it themselves. So it provides a level of sincerity. And I think that the trust that comes from being a part of the community, being able to say, I do this because I value my health and I value your health, so I suggest that you also do a preventative visit or, take care of yourself in a different way, that really adds a more impactful recommendation.
I think every employee should have a program like that. They made me feel amazing here because they do care about their patients and their employees. I never got treated different being an employee or a patient.
Centers like Mountain Comprehensive Health Corporation are more than just healthcare facilities. They are lifelines that empower individuals to take control of their health, instilling pride, productivity, and progress in every corner of the state.
Well, when you talk about healthcare, it could be anything from your annual visit all the way through a major acute care visit at a hospital. And what we're encouraging is that the individuals take care of themselves and make that commitment to have the preventative care and hope to avoid those catastrophic experiences, and that we can all show up better for our community. Health centers can build healthier communities one patient at a time. And by creating this resource, where information, guidance, care coordination can be accessed at a local level, everyone benefits.
One of the great things about the program is it helps vindicate what we're all about. If our employees are out telling people what we do, how it's helped them, then it encourages people out in the community to also get their annual exam. Preventive exams is one of the keys to good health, and that's the whole idea, is get away from episodic care and start approaching chronic care. As you probably know, chronic conditions in southeastern Kentucky are the highest in the country. We'd like to move that needle. This is just a small way of starting that process.
Convenient and high-quality primary care is the best strategy to maintain health and experience a better quality of life.
When I first found out about my results, it was a tough time for me, but they all came together like a family for me, and they were there through everything. I mean, friends, family, my coworkers. I mean, if I wasn't an employee here, I probably would have never had the wellness exam done, and I would have never found out that I had breast cancer.
Kentucky Primary Care Association's mission is to improve our members' capacity to care. Our members are federally qualified health centers or community health centers like Mountain Comprehensive Health Corporation, and what we do is help to improve their outreach and their ability to have the high-quality providers through workforce development, have access to the services that for training and technical assistance, and advocacy in order to support Kentucky's safety net. Our goal is for our members to be able to have more time taking care of their patients and for their patients to have healthier lives.
To learn more and find a provider near you, visit kpca.net today.